Welcome to the deep dive. You're here because you want to get informed without the fluff, and, well, that's what we aim to do. Today, we're diving into something that touches almost everyone as they get past 40. Common orthopedic issues. You know, the aches and pains that start showing up.
Yeah, definitely. And for this, we've pulled together insights from, well, a really wide range of places. We looked at core medical info from sites like Mayo Clinic, Cleveland Clinic, Duke Health.
Your big names.
Exactly. And combined that with practical stuff from orthopedic centers, Centers for Advanced Orthopedics, Coastal Orthopedics, Eros Area. Plus, we even factored in perspectives from fitness resources like the Fit Father Project, Texas Health Resources, and KaiRS.
Right. So our mission today is basically to boil all that down, pull out the key takeaways. We want to help you understand why this stuff happens more often as we age, what the common problems actually are, and, most importantly, give you some proactive steps you can take. Okay, so let's just jump right in. What's actually changing in our bodies after 40? Why do these orthopedic problems become, well, more common?
Well, fundamentally, it's about natural processes just slowing down a bit.
Mm.
A big part is the body's own repair and strengthening mechanisms. They don't stop, but maybe the pace isn't quite what it used to be. Think of the maintenance crew being a little less speedy.
That's a good analogy. So things that used to heal quickly maybe take a bit longer now.
Precisely. Another huge factor is bone density. Our bones naturally lose some density as we age.
Uh-huh.
This makes them a bit more fragile, more prone to fractures, not just major ones, but also those little stress fractures.
Right. Osteoporosis is the term people often hear, especially for women later on.
Exactly. And while women are more prone to osteoporosis after 70, bone loss actually starts much earlier for everyone. This can lead to things like vertebral compression fractures or, the really impactful hip fractures.
Things you definitely want to avoid. And it's not just the bones, right? What about muscles?
Oh, absolutely. Muscle mass tends to decrease. It's a process called sarcopenia. It's not just fewer muscle cells, but the fibers themselves can shrink a bit too. This means less support around the joints, making injuries more likely, especially if you suddenly ramp up your activity. The weekend warrior effect.
Ah, yes. I know that one.
And this muscle loss, it can start subtly around age 30, but really accelerates after 40.
So deciding to suddenly lift something heavy or go for a massive run gets riskier.
It does. Then you have changes in cartilage that smooth cushion in our joints and tendons, which connect muscle to bone. Cartilage tends to hold less water as we age. Imagine a sponge drying out slightly. It gets less springy, more prone to wear and tear.
Leading to things like osteoarthritis.
That's often the pathway, yes. And tendons. They can become drier, stiffer, less resilient. This increases the risk of tears or even ruptures.
Ouch. Like the Achilles rupture we sometimes hear about.
Exactly. We'll get into that one specifically. But it's a prime example. Even ligaments, the tough bands connecting bone to bone that stabilize joints, they lose some elasticity.
So they're more easily damaged too.
Yeah. That sprained ankle you might have walked off in your 20s, it might take a lot longer to heal now. And knee ligament tears, shoulder ligament tears, they become more likely.
So it's like our body's natural shock absorbers and stabilizers are just becoming a little less effective over time.
That's a really good way to put it. But, and this is really important, the timing and severity vary hugely from person to person.
Right.
Your lifestyle, diet, weight, activity level, genetics, they all play a massive role. And if you've had previous injuries, say a bad knee injury younger in life, or if you're carrying extra weight, these changes might show up earlier or be more intense.
Okay, that makes sense. It's not one size fits all.
Not at all. It's very individual.
All right, so let's get into some specifics then. What are some of the most common orthopedic injuries or conditions people start facing after 40? Maybe start at the top, like the shoulder. Rotator cuff seems common.
Oh, incredibly common. Rotator cuff issues, tears, tendonitis, they often come from that cumulative wear and tear we talked about. But also, overuse is a huge factor, especially repetitive overhead motions.
Like what? Painting, reaching up high.
Exactly. Painting, reaching into high cabinets, throwing sports, even swimming sometimes. And of course, a fall onto your arm can cause a tear too. It's surprisingly widespread. Some studies suggest maybe 10% of people in their 50s have some kind of tear, and that jumps to maybe half of people over 70.
Wow, half. That's significant. So what would you feel? What are the symptoms?
Often it starts as this nagging ache in the shoulder. You might notice it during simple things like washing your hair, lifting groceries, reaching behind you. The pain's often on the side of the shoulder, and sometimes it radiates down towards the elbow.
Okay.
And a big one is nighttime pain. It can really disrupt sleep, especially if you lie on that side.
Yeah, that sounds rough. So what can you do to try and prevent this, or at least manage it?
Prevention involves a few things. Good posture is key, avoiding that slumped forward shoulder position.
Right. Stand up straight.
Basically, yeah, gentle stretching to maintain range of motion is important. And some simple strengthening exercises specifically for those rotator cuff muscles can really help stabilize the shoulder. Also, just being mindful of how you lift things and maybe modifying exercises that involve a lot of overhead stress.
Good practical advice. Okay, let's move down the body. You mentioned the Achilles tendon rupture earlier. That sounds pretty dramatic.
It can be, yeah. It's a tear in that big tendon at the back of your lower leg connecting your calf muscle to your heel bone. We see it a lot in, recreational athlete sports with jumping, sudden starts and stops. But really, it can happen to anyone if the tendon gets suddenly overstretched. It can be a partial tear or a complete rupture.
What does it feel like if that happens? Is it obvious?
Oh, usually very obvious. People often describe feeling like they've been kicked hard in the calf.
Ouch.
Yeah. Then comes pain, often severe swelling near the heel. And functionally, you'll likely find you can't really bend your foot down properly or push off that foot to walk. Standing on your toes on that leg, probably impossible.
And I've heard people say they hear something.
That's very common too, a distinct pop or snapping sound at the moment it happens.
Yikes. Definitely gets your attention. Are there specific risk factors for this one?
There are. Age is one. Peak risk is often in the 30s and 40s. It's also more common in men. Those recreational sports we mentioned are a big factor. Interestingly, steroid injections near the tendon can sometimes weaken it over time. Certain antibiotics, the fluoroquinolones like Cipro, have also been linked, though that's less common. And obesity adds extra strain.
Okay. So how do we protect our Achilles tendons?
Prevention focuses on strength and flexibility. Regular calf stretching is vital. The wall stretches, both straight leg and bent knee.
Yeah, I know those.
Strengthening the calf muscles themselves, like with calf raises, helps them absorb force better. Varying your exercise, mixing high and low impact is smart. Choosing good running surfaces, having cushioned shoes helps. And crucially, if you're increasing activity, do it gradually. That rule of thumb, no more than about 10% increase in intensity per week. That's a good one here.
Gradual progression again. Seems like a theme. Okay, let's shift to the foot itself. Plantar fasciitis that causes heel pain, right? Lots of people seem to get that.
Extremely common, yes. It's inflammation of the plantar fascia, that thick band of tissue on the bottom of your foot running from the heel to the toes. It supports your arch.
And what's the telltale symptom?
Usually a sharp stabbing pain right in the heel. The classic sign is that it's worse with the very first steps in the morning.
Oh yeah, getting out of bed pain.
Exactly. It often eases up a bit as you move around, but then it can flare up again after you've been standing for a long time, or after sitting and then getting up again.
Who tends to get this most? Are there risk factors?
Age is one, typically between 40 and 60. Certain exercises put a lot of stress on the heel, long-distance running, ballet, high-impact aerobics. Your foot mechanics matter too. Flat feet, high arches, even how you walk can put extra strain on that fascia.
Yeah.
Obesity is a factor again, adding more load. And occupations that involve standing for long hours on hard floors, think teachers, factory workers, nurses, they often see higher rates.
And just trying to push through it, probably not a good idea. Any complications?
Not ideal, no. It can lead to chronic heel pain that really limits what you can do. Plus, you might start walking funny to avoid the pain, right? And that altered gait can then cause problems elsewhere, your knee, your hip, even your back. It's all connected.
It really is. Okay, moving up from the foot, hands and wrists. Carpal tunnel syndrome.
Right. Carpal tunnel syndrome happens when the median nerve gets squeezed or compressed as it passes through that narrow tunnel in your wrist. Swelling inside that tunnel puts pressure on the nerve. This nerve handles sensation for your thumb, index, middle, and part of your ring finger, and controls some thumb muscles.
So what symptoms would point towards carpal tunnel?
Numbness and tingling are classic, often pain too, and sometimes weakness in the hand and wrist. People might notice it especially in the fingertips of those specific fingers. Difficulty holding things, maybe dropping objects, feeling clumsy. And often, like the rotator cuff, symptoms can be worse at night, sometimes bad enough to wake you up.
What puts someone at higher risk for this?
Repetitive hand and wrist motions are a big one, especially forceful or sustained movements. Think assembly line work, using vibrating tools for hours, even lots of typing for some people.
Okay.
Pregnancy can trigger it due to fluid retention. Generally, being female increases risk, as does being over 40. There might be a family history component too. Yeah. And certain health conditions are linked: arthritis, gout, hypothyroidism, diabetes, obesity.
So for those of us typing away or doing repetitive tasks, what can we do to try and prevent it?
Regular wrist and hand stretches can help maintain flexibility. If your job involves risk factors, using proper ergonomic equipment, maybe padded gloves is important. Taking frequent breaks is key. Give those wrists a rest. And pay attention to your technique and posture. Try to keep your wrists in a neutral, straight position as much as possible.
Good tips. All right, let's tackle a big one. Knee pain. Seems almost inevitable for many people over 40.
It is incredibly common, unfortunately. A lot of it comes down to that age-related wear and tear on the cartilage in the knee joint. The knee takes a lot of load, being central to weight bearing and movement, so it's vulnerable over time.
And it's not just the cartilage inside the joint, right? I hear about other things contributing.
Absolutely. Tightness in surrounding structures can make a big difference, like the IT band running down the outside of your thigh, or tight hip flexors, tight quadriceps muscles. These can change how the kneecap tracks or put extra stress on parts of the joint. We also see injuries like ACL tears and meniscus tears become more likely. The tissues just aren't quite as resilient. Women tend to have more ACL tears. Biomechanics, hormones might play a role. Meniscus tears, those shock absorbers in the knee, can happen during sports, sure, but also just from everyday stuff: stairs, hiking on uneven ground, kneeling down.
So what's the approach to keeping knees healthier as we age?
It's really a combination approach. Things like foam rolling can help address tightness in those surrounding muscles, the IT band, quads. Targeted strengthening is crucial, not just quads and hamstrings, but also the muscles around the hips, like the glutes. Stronger supporting muscles mean less stress on the joint itself.
Makes sense.
And staying active is vital, but focusing on low-impact options is often smarter for the knees. Swimming, rowing, cycling, walking, tai chi, yoga, great choices. They maintain mobility and strength without pounding the joints.
Okay, moving up to the core now. Lower back pain. Another huge issue, and I hear it mentioned a lot for men over 40 specifically.
Yes, very prevalent. Common factors include becoming more sedentary, weight gain, arthritis developing in the spine, and that bone density loss we talked about earlier. But there's another factor, kind of a postural thing called rib flare, that can contribute significantly too.
Rib flare? Haven't heard that linked to back pain before. What is that?
So imagine your lower ribs sticking out, kind of flaring upwards and forwards. It creates an exaggerated arch in your lower back.
Okay, I can picture that.
This posture leads to muscle imbalances. You end up overusing your lower back muscles, maybe your chest and neck too, while underusing your core stabilizers, your abs, pelvic floor, diaphragm. This instability puts more strain on the lumbar spine.
So it's less about the spine itself and more about the muscular support system being out of whack because of rib position?
In many cases, yes.
Yeah.
And what causes rib flare? Could be poor breathing habits, like breathing mostly with your chest instead of your diaphragm, weak abs, tightness in the chest or back pulling the ribs, or just, bad postural habits.
Interesting.
Of course, you also have the more direct spinal issues causing pain, herniated discs, degenerative disc disease, spinal stenosis narrowing the spinal canal. And sciatica, that nerve pain down the leg, is very common too.
So for managing lower back pain, especially thinking about this rib flare idea,
strength training is key, but with a focus on core stability and addressing that rib flare. Learning proper diaphragmatic breathing, strengthening the deep abs, releasing tight chest muscles, maintaining a healthy weight is always important for the back, and just being mindful of your posture throughout the day, trying to keep that rib cage down and aligned over the pelvis.
we've covered a lot of major joints. What about those more general overuse injuries, like tennis elbow?
Yeah, repetitive strain injuries are definitely a top reason people see an orthopedist after 40. Tennis elbow or lateral epicondylitis affects the tendons on the outside of your elbow, causes pain, tenderness, often a weak grip. And despite the name, it's not just from tennis. It can be from anything repetitive. Hammering, gardening, playing musical instruments, typing, using tools.
So lots of everyday activities.
Exactly. And tendinitis can pop up elsewhere too, like we mentioned with the rotator cuff or Achilles. Prevention for these is mostly about avoiding those prolonged repetitive motions if you can, using good technique, and taking frequent breaks. Let the tissues recover.
Right. And one more specific type of injury, stress fractures, these seem a bit different.
They are. They're tiny hairline cracks in the bone, usually from repetitive impact, not one big trauma. Most common in weight-bearing bones, lower leg, foot. Think tibia, metatarsals.
And what increases the risk?
High-impact activities, especially on hard surfaces like running. That bone density loss we discussed makes bones more susceptible. And again, sudden big jumps in training intensity or duration.
So how do you prevent those?
Gradual increase in activity is crucial. Give your bones time to adapt. Proper footwear with good cushioning helps. And cross-training mixing up activities spreads the stress around.
Okay, so that gradual progression, listening to your body, proper form, these seem like recurring themes across the board.
Absolutely. And that really leads into the general strategies for prevention and management that apply to pretty much all of this. Staying active is number one, a mix of cardio and strength training. The guideline is usually around 150 minutes of moderate aerobic activity a week, plus strength work for all major muscle groups at least twice a week.
Mm-hmm.
And like we said, emphasizing low-impact activities can be really beneficial, especially if you have a history of joint issues or high-impact sports.
Swimming, cycling, walking, yoga.
Exactly. Nutrition matters too. Getting enough calcium, vitamin D for bones, protein for muscles. Maintaining a healthy weight takes so much stress off the joints. Regular stretching is vital for flexibility. Focus on areas prone to tightness, hamstrings, hip flexors, shoulders. And remember, gentle holds, no bouncing. The biggest thing, maybe, is listening to your body. Don't push through sharp or significant pain. Use proper form in everything, exercise and daily tasks. Take breaks during repetitive work. Consider protective gear if needed. And, really importantly, if you do get injured or have pain that just isn't going away, seek medical advice. Don't wait too long.
Yeah, early intervention can make a big difference.
Huge difference. It can prevent complications, long-term damage. Treatments range from simple RICE, rest, ice, compression, elevation, and physical therapy, right up to medications or sometimes surgery if needed.
So wrapping this up, the main takeaway seems to be, yes, orthopedic issues become more common after 40 because of natural aging changes. But it's definitely not like we're doomed to just fall apart.
Not at all. That's precisely the point. By being proactive, consistent, appropriate exercise, stretching, healthy lifestyle choices, getting help when you need it, you can seriously mitigate these risks. You really can maintain an active, mobile, and fulfilling life well beyond 40.
It definitely gives you food for thought, makes you consider which of these points might apply to you, the listener, maybe things you're already feeling or things you want to prevent.
Yeah, and it leads to a kind of interesting final thought, doesn't it? Thinking about how interconnected everything in our musculoskeletal system is. How might focusing on fixing one seemingly small thing, maybe improving your hamstring flexibility or just consciously working on your posture every day, how might that ripple outwards? What kind of positive impact could that have on your overall comfort and mobility as you keep aging? It's definitely something worth considering.